Hi, everyone. Thanks so much for joining us. We're really glad to have you here on this podcast that is geared toward consumers, those of you out there who are trying to figure out what is therapy, how do I find it, and what is right for me. So today, our fabulous guest is one of our very own. She works in our practice, the Juniper Center in Park Ridge, and does telehealth. I'll tell you all about that in a minute. But today we're talking about medication, because a lot of folks are on medication or have considered medication and they don't know, oh, what should I be taking and who do I trust? And should I go to my primary care doctor? It is okay for my endocrinologist to prescribe my antidepressant or my gynecologist. Why come to a prescriber who is trained in prescribing drugs that are for mental health conditions? So we're going to talk all about that today, but let me introduce you to a wonderful, wonderful guest. She and I share several people together where I'm doing the psychotherapy or Anne is doing the psychotherapy and the prescribing. She's an amazing clinician. Let me tell you all about her. Dr. Ann Thatcher has an expertise at caring for patients experiencing mood disorders, anxiety disorders, obsessive compulsive and related disorders, psychotic disorders, which folks, not everyone has that, and medical comorbidities, and I'll let you explain what that means in a minute. Dr. Thatcher provides culturally competent, holistic care with a strength-based and person-centered approach and has vast experience working with patients from diverse racial, ethnic, religious, spiritual, and socioeconomic backgrounds. As a member of the LGBTQAI plus community, she's an advocate of the expression of self-identity. I love that. No matter how one identifies, and that's just a big value in our practice. So I love you just fit in there perfectly in that way as well. She uses a team mentality truly when providing care and sees the captain of the team as the patient themselves, which I love. Dr. Thatcher individualizes the plan of care. She offers several psychotherapeutic modalities, including cognitive behavioral therapy, cognitive processing therapy, motivational interviewing, and supportive psychotherapy. She has extensive experience working with adolescents to develop life skills and establish self-identity during an often tumultuous stage of life. I have one that's now 21 and one that's 19. Tumultuous it can be indeed. It's a challenge to be young today. Her goal is to support patients as they progress on their journey to mental wellness and toward living their optimal life. Her patients range from 12 to 65 years of age, and she sees them remotely via our telemedicine video platform. So if anyone has any doubt that you know what you're talking about, Anne, I don't know what to tell them, but welcome, Dr. Ann Thatcher. Thank you so much for joining us today. You are such a busy, productive, caring person. I really appreciate you taking the time out to do this.
Of course, thanks for having me. I appreciate it.
Absolutely. So why don't we start, because I think most of the folks who are listening to us are probably adults. So let's start there, and maybe they're concerned for their children, but let's start talking about adults. If adults are seeking some kind of medication management, maybe, we can talk about what does medication management mean? Where is the best place to start and why?
Yeah, so that's a really great question. Medication management essentially means that the level of functioning of a mental illness has deteriorated to the point that therapy by itself is no longer working. A lot of our gold standard treatments for psychiatric disorders is a combination of therapy and medications. So, like in my practice, I require all of my medication management patients to be with a therapist because that combination is so strongly linked in the research in terms of best practices. A place to start. So if you're most comfortable with your primary care provider, start with your primary care provider. You can always ask them if that's within their scope of practice. Typically, the limitation of a primary care provider is going to be one medication for a disorder. So when you start to get into multiple psychiatric medications that are needed, so maybe you need one for sleep and maybe you need one for mood, or maybe you need one for anxiety and you need one for OCD. So once you start getting into more than one medication, that's then out of the scope of practice of a primary care provider. right? And they typically are seeing things like anxiety, depression, sometimes ADHD, especially if you can't get into a provider to be seen. But that's kind of the limitation. They're not great at things like psychoses or bipolar disorder or some of the more complex psychiatric disorders. They're not necessarily great at treating trauma, those types of things. And so it's a good place to start if you have one of those kind of very, very common disorders that those providers are learning about and how to treat. If more than that, then if you have a diagnosis or you suspect you have a diagnosis that is beyond that, depression, anxiety, maybe sleep issues, maybe ADHD, if it's beyond that, then I would say seek out a professional that is a mental health prescribing practitioner. So that could be a psychiatrist who's a medical doctor, or a psychiatric mental health nurse practitioner who is a nurse practitioner that specializes in psychiatric care. That's what I am. So I'm a doctorally prepared psychiatric mental health nurse practitioner. And so sometimes starting with your therapist. So let's say you already have an established therapist and maybe you've been talking about, well, it's not quite working yet. Maybe we add on medicines. That's a great place to get connected with a provider. So at Juniper, a lot of our therapists start with a patient and then realize maybe meds is a good add-on. And so they will reach out, coordinate care, and get that patient scheduled for an intake. If you're in the community and you're not necessarily in the Chicago area, you can also, a great place to look is psychologytoday.com. So it's a website that I like to recommend to patients that are looking outside of Juniper for other things, but you can put in the kind of provider you want. So whether that's a therapist or a psych NP or a psychiatrist, you can put that in with your zip code and it will show all the providers that have availability, what insurance they take, what they specialize in, what ages they see. So that's a really great resource to have in your pocket. So if primary care doesn't work out or your therapist doesn't have a connection to a management provider, then going online and looking at something like psychologytoday.com is a good option.
Those are great recommendations, right? Because you were referring to Juniper, folks. If you're not aware of the name of our practice, is the Juniper Center. Again, we're in the Illinois area, but you might be in Texas or you might be up in New York. And so Psychology Today, or even if you're in this area, Psychology Today is a great resource. So, and you mentioned your credentials, and I know this happens. I've tried to give your name to a few folks and said, this is one of my favorite prescribers that I have ever worked with because you're exceptionally collaborative, you're really smart, you're really on top of things. And they've said, but she's a nurse. I want a doctor. I want an MD. I would imagine you run into that. And then I certainly have my way of explaining that. But the folks who are looking, why does it matter if you're an MD or have the designation that you do? Can you just explain a little bit about that so people know?
Sure, absolutely. So, as a psychiatric mental health nurse practitioner, I have the same ability to prescribe medications, do psychotherapy, diagnose mental illness as a psychiatrist. The difference between myself and a psychiatrist is really how we're trained and how we see healthcare. So, a psychiatrist is a medical doctor and they're trained in what's called the medical model. So, a lot of times, and this is not across the board for every psychiatrist, but for a lot of psychiatrists, appointments tend to be very short. They're 15 minutes, maybe 20 minutes. They're very focused on finding what's wrong with you and taking it away. So it's very focused on symptoms and side effects and medications, and that's kind of it, which is great if that's all you're needing. Psych nurse practitioners are trained in what's called the biopsychosocial spiritual model. So it's this very holistic perspective of healthcare. So I ask patients about their social support system, their finances, their housing, their jobs, their kids. I get to know the patient as the whole picture. I ask about their hobbies, all those kinds of aspects of their life, because I don't see patients as simply symptoms. It's to take away, right? I look at their strengths, things that they can augment and build up to help their mental health instead of just taking away the negative symptoms, right? And so you read in my bio, I really do see healthcare as this is a team approach and that patient is the captain of the team. For me personally, the way I practice is teach my patient about what's happening in their brain and body, even down to neurochemistry at the level that they understand it, and then teach them about medicine options, non-medicine options, and complementary alternative medicine options. And whatever the patient decides is going to be the best treatment for them is what we do. Not all providers do that. you're more likely to find that approach with a psych nurse practitioner because of that holistic perspective than a psychiatrist. But that approach isn't for everyone. Sometimes the patient's like, I just need you to tell me what to do. And that fits great for a psychiatrist. And again, that's not across the board for all psychiatrists. That is just a theme that is seen in the prescribing community. So.
Well, and I'll tell you, it feels to me like on our team and other nurse practitioners whom I have met, the competency level is incredibly high. The knowledge is incredibly high. So folks don't count out folks like
Yes.
Dr. Ann, who is absolutely competent, capable, and an excellent prescriber and provider. So
Yes.
just something that I think some folks sometimes get kind of caught up in. And
Absolutely.
sometimes they don't have a psychiatrist nearby either, and it might be easier to connect with
Yep.
a psychiatric nurse practitioner. So
Absolutely.
that might work out just fine. So we talked about adults. You also see kids 12 and up. So for parents out there who are listening, what might this look like for them? What are some things they ought to be thinking about when they're trying to find a prescriber, and if their child is going to be taking medication? Because of course, medication, it's a big deal. And for our children,
Absolutely.
it feels like an even bigger deal. So what are some things parents should be thinking about?
Absolutely. So I oftentimes have parents that are hesitant to start medications for a patient because it's an unknown and they don't want to interrupt their child's brain development. The reality is that if the child is having functioning issues, they're no longer able to maintain friendships, they're having trouble in school, they struggle at home, then if they're unable to function, that's when we are at the level of a mental illness, right? And so the option is keep just trying what you're trying, or try something that's been shown to be proven effective and safe, FDA approved for a kid of that age, no matter what the age is. Providers are trained, especially psychiatric mental health nurse practitioners that do extra training in pediatrics. We have one right now at the Juniper Center who has extensive training in pediatric psych, and that's all she does. We also have a child psychiatrist, and they're specially trained in pediatric psychiatry. And so basically, what we tend to do in pediatric psychiatry is more on-label use of medications than off-label use, which we may do more in adults. And so there's extensive research behind that, and that supports the use of those medications and has shown things that aren't impacting brain development.
So on-label use means what, and off-label use means
Yeah,
what?
that's a great question. So on-label use means the FDA, the Federal Drug Administration, has done and reviewed all the research behind that medication with that age group. And they've been able to show any side effects that the kid might have or the person might have, but they've approved it that it is safe for use, safe and effective for use for that disorder, for that age group. Off-label use is a medication that the FDA hasn't approved for a specific disorder or age group, but research still shows is effective for whatever the disorder or age group is. In pediatric psychiatry, we do a lot more on-label prescribing than off-label. So we really follow the research strongly and the federal guidelines around them.
Boy, that's great. Yeah, that's good information, because I think with some adults, it sounds like doing more of a cocktail or something might have been intended for a seizure disorder, but it's used to treat something else. But with kids, boy, this is it. If it's intended for depression, it's for depression. So I've worked with some parents who have said, I know my child needs to see a prescriber. They probably need medication because their anxiety is not responding, or their depression is not responding to psychotherapy alone, to your point. But they've read, they've consulted whom we all consult, Dr. Google, Dr. WebMD, they look it up and they say, oh my gosh, what if my child develops suicidal thoughts as a result? So how do you address some of those fears that parents might have about that issue in particular?
That's a really great question. So, anxiety is a really common pediatric disorder in psychiatry. It's the leading disorder that we see in peds at this point, that and depression once you get into adolescent age. So the best practice treatment for that would be an antidepressant that treats anxiety and depression. And the class is called an SSRI, which would be a selective serotonin reuptake inhibitor. So basically, what you would find online if you looked up the use of an SSRI with a kid, there's something called a black box warning, right? And so that is a warning that they place on medications to say, this is a possibility, right? This is more dangerous. This is a risk, right? The reality, so the black box warning on an SSRI for pediatrics is in that age group, the risk of suicidal ideation can go up. The reality of the research behind that, if you actually looked in through the research behind that black box warning, it was tiny numbers of patients that had any suicidal ideation increase. And the researchers determined, and the FDA determined, that any increase in suicidal ideations warranted a black box warning. The likelihood of that actually happening is very, very, very small, right? So it sounds very scary. So what I do is I always educate about that risk, right? So I don't want it to be a surprise. And I teach the patient and the parent how to talk about suicidal thoughts, right? And so I talk to the parent about, here's this kind of spectrum of suicidal thoughts that can happen, all the way from I don't want to exist anymore, I can't do this anymore, all the way to having a plan and intent. There's a big spectrum of suicidal thoughts. So I teach the parent how to ask that question, and I actually teach them this green, yellow, red zone of suicidal thoughts, and so that they have a language to talk about that with their pediatric, with their kiddo. And I teach the kiddo what each of those levels means and how to talk about it. And so if that were ever to happen, we would know immediately because we're talking about it, right? And if it were to happen, we would obviously stop the medication. In all the years that I've been working in pediatric psychiatry, I have never once had a patient have increased suicidal ideations because of an SSRI. And I've been practicing in pediatric psych since 2014. So, and then as a prescriber since 2018. So that's not common, but it is a black box warning, so it scares parents.
Yeah, right, right. Okay, so something to be aware of, but it's not an enormous stop sign. It might be a
Yep.
yield, read it, think about it, but
Yep.
consult a qualified prescriber and talk
Yes.
it through and make sure
Exactly.
that the client, the kid, and the parents know how to have those conversations. I love
Yep.
that green, yellow, red zone.
Yep.
I love that. That's excellent. So if someone decides they want to see a prescriber, maybe they've tried something, I mean, this is often the case, they've tried something through their primary care and the primary care may have one or two medications with which they are comfortable and familiar, but those have not worked. So
Mhm.
some people will say, well, these medications don't work for me. Um,
Mhm.
so what would you say about that? And why can it be a little bit complicated to find the right medication for that person?
That's a great question. So, genetically, humans are so very different, right? No two humans have the exact same genes unless you're identical twins. And so, genetically, there's a lot of variation that can happen genetically that impact the level of different neurotransmitters, the different receptors. And most of our psychiatric medications are processed through our liver. And so there's something called the CYP450 enzyme chain, which is basically this chain reaction in your liver that happens of these molecules that break down the medicine until it's an active medicine in your bloodstream. And so everyone's liver enzyme chains, there's multiple different ones, and they all have different genetic variations. And so everybody's going to be a little bit different in terms of what medicine's going to be best for them, what dose is going to be best for them. And so a lot of times, primary care providers aren't well versed in how to adjust medicines. They're very cautious with titrating doses. So oftentimes they'll get someone from primary care who's on a medicine that's on a subtherapeutic dose because the provider was afraid to increase the dose. And of course, it's not going to work. It's not therapeutic. It's not the right level of that medicine.
A therapeutic dose means you have enough in your system.
Exactly, right? So you're taking it, but it's not doing anything because it's not at a level that's going to do anything, right? That happens pretty frequently in primary care. Not always, but frequently. We now have science has come a long way in prescribing. So now we have something called psychogenomic testing. And essentially, it's genetic testing that shows us all of those genetic variations, all the liver enzyme chain variations, the receptor variations, all those different pieces that can tell us what's the right medicine for a given person. And so if a patient comes in and they're very frustrated with the process of finding a medication that works, which is a frustrating process, we can do genetic testing and we can say, okay, for you specifically, this is going to be the right med. This one should work. And then we get to a therapeutic dose of that medicine, or we might have several options. And in my experience, that almost always, 9 times out of 10, is we're going to be able to find the right medicine.
It's one of the things I love about working with you, Anne. I mean, in addition to all of the knowledge that you have, and you also are trained as a licensed clinical social worker, so you have a lot of therapy skills in addition to what you do as a prescriber. But you do the genetic testing, which just really must narrow that down exponentially so that you aren't just saying, well, generally speaking, right now, this is the medication that I've been reading about is it's that plus, and here's some genetic testing. Is that expensive, the genetic testing?
A great question. There's a lot of different companies that do it. So the company that we use is one that they say the max out-of-pocket cost is $330, but they want to make it available for everyone. So they actually do payment plans as low as $5 a month with no interest of any kind. And so they want to make it affordable for everyone so that it's not cost prohibitive to get the best quality care. Really, what's happened with genetic testing is in the past, before this existed, psychiatry was kind of a guessing game. We made educated guesses based on what we knew of the medicines and what we thought we knew about where symptoms were located in the brain and different pieces like that. And it was like kind of a guessing game, and patients often felt like a guinea pig, like, let's try this, let's try that. And so it's a very frustrating process. Psychogenomic testing has made it so that those educated guesses are no longer guesses. We have actual facts, actual science around how you metabolize this medication. And it has narrowed down how the dosing that we have to get to. It narrows down which medicines are just not going to work or will cause bad side effects. So we know so much more because of it.
Hmm. Yeah, I'll tell you again, sharing cases with you, sharing clients with you. When I say case, I mean, that means we share a client together.
Yes.
That has had a huge impact. I think people just feel more reassured that there's some science behind some of the choices based on their physiology, in addition to the prescriber's good judgment. So that's a great combination of the two. So when folks are needing a prescriber, and we're talking about the money portion, as we know, you and I know, insurance covers these services. And we can check, any place you go, hopefully they can check your benefits. People can call their insurance company and ask what are their benefits. How does that work, though? Are most prescribers covered?
Yes, so that's a really great question. So a prescriber is covered if they are credentialed with an insurance company, right? So it is up to the prescriber or the agency where the prescriber works to determine if they're being credentialed with any given insurance company. And so, for example, some prescribers at our practice only are with a couple of different insurance companies, and others are with a whole lot more. And so it completely depends on the provider's preference. Basically, looking and identifying, does the prescriber that you're wanting to see take your specific insurance? Also, there's a difference between PPOs and HMOs, right? So there's different kinds of insurance. And so some places will only accept the PPO version of Blue Cross Blue Shield as opposed to the HMO version. And it can be very complex, confusing. So making sure that you're calling the agency that you're wanting to get with or provider that you're wanting to get with, very clearly identify what insurance you have and ask if they take it.
That's, I think, very sound advice. And we do check insurance benefits for everybody just so they know. And folks, my strong suggestion is that you please call your insurance company and check yourself, because it is stunning to me that we can have one of our people will call one of our billing team, a member of our billing team will call the insurance company. They will get some information from the insurance company. And it turns out the information is incorrect. How could that even
Yep.
happen? Well, it just does. These are behemoth organizations. One
Yeah.
digit was off, that when they keyed it, anything can happen. Just
Yeah.
call yourself. Make sure you know what you're getting into. Don't just rely on the entity to find out for you, because
Yes.
we might get different information, and then let's have that conversation. So and I was coming in to see you and I hadn't seen a prescriber before, how should I prepare for my very first appointment? What should I bring? What do you need to know? You need to know about my supplements, all my other medications, my diet, my sleep schedule? What should I be prepared to talk to you about in that first appointment?
It's a great question. So, what is very, very helpful is when a patient has a list of medications they've taken and the doses they've taken. And I always ask about past medication trials and then current medications, both psychiatric, physical supplements, herbal supplements, vitamins, the whole shebang. So, anything that you're adding to your normal diet is helpful information. So, if you have taken or tried a lot of different medications, having a list of those can be very, very helpful, especially having the dosage. Any past psychiatric hospitalizations that you've had, that information is very helpful. So, were you inpatient? Were you intensive outpatient, partial hospital? How long? When? Why? That information, that history is very, very critical to providing better quality care. It gives us that history, no matter how remote it is, no matter how long ago that happened. And that might not be where you are today, but that information helps us. And
Excellent.
in
Okay.
terms of symptoms, also, any kind of current symptoms you're having, are you having trouble sleeping? Is your appetite off? Is your mood off? Anxiety? All the things.
Okay, great. And I'm assuming it's helpful to know supplements, like anything I'm putting in my mouth.
Mhm.
Is that useful for you to know? Or, what, don't
Absolutely.
worry so much about that in the first appointment. Maybe we'll get to it.
It's very important because there's quite a few different psychiatric medications that are contraindicated if you're also taking a supplement, of specific supplements. For example, St. John's wort is a common herbal supplement that people will take to help with their mood. That is contraindicated for all of the antidepressants. It can cause something called serotonin syndrome, which we don't want. And so knowing that you're taking St. John's wort is going to be helpful for us to make sure you're safe, right?
Okay, great. So
Right.
if somebody's coming in, hopefully they'll come in and we'll just tell you. And I can say this as a therapist, you can say this as a therapist and prescriber, I would imagine, but I don't want to speak for you. The more open people are, I mean, if my walls could talk, I've been doing this for 30 some years.
Sure.
It's been a while since my hair got blown back, right?
Yes.
So people can come in and it's really important that they tell us as much as they can
Yes.
so that we know what's happening in their lives, what's happening in their minds, what's happening in their bodies and their nervous systems, all of that.
Absolutely. Yeah.
Um, right? And if you
Absolutely.
take edibles every night to go to sleep, please tell your prescriber. Anne's not going to
Yes.
judge you. So,
Yes. If you're using cocaine or ecstasy on a regular basis, tell me. That helps me know things, right? That helps me make sure you're safe. There is no judgment. I have heard all the things in my time doing this. Like I said, I've been a prescriber since 2018, and there is nothing that surprises me anymore. Even things that around like your sexuality, that's oftentimes a touchy subject for patients, right? And so some of the psychiatric medications can cause sexual side effects. If you're afraid to talk to me about your sex life or your experiences with sex, you're not going to tell me that side effect is happening when it doesn't have to, right? And so being as open and honest about all the things, bodily functions, maybe you're more gassy, maybe you're constipated, maybe you have urinary incontinence, all of those things are things that we can help with. And so anything is game, is fair game.
yep, exactly. We need to know. So the
Yes.
more open people can be, the better. So, Anne,
Mhm.
is there any final thought you would like our listeners to take away if they're considering medication for themselves or for their children? Any final thoughts?
Yeah, so one is that a lot of patients come in and assume that I'm going to push meds on them, that they're coming to see me for meds, so I'm going to push meds on them. And that's not the truth, right? So the right provider for you will support whatever your decision is. So I have patients that come in for med management and don't want to take any medications, and that's okay. So we do complementary alternative medicine options or non-pharm options. different kinds of therapeutic techniques or approaches, different kinds of apps that you can get on your phone that can be helpful. And, I have gotten more well-versed in supplements and vitamins and different kinds of things that can help different disorders. I have an entire database that I use that has research on the complementary alternative medicine treatment options. So if medicine isn't for you or isn't for you yet, and you want to try these other routes, don't assume getting an appointment with a psychiatrist or psych nurse practitioner is going to mean you're forced to be put on medications, because that's just not the truth. That's not the case.
I love that. And especially someone like you, and who has a mental health background as a therapist as well. You really are very well-rounded, and you're not always going to prescribe. I think that's true for everybody on our team.
Absolutely.
That experience with has said, maybe you need medication, maybe you don't. So that is a common misconception that I'm glad you brought up. Well, folks, if you have any questions, how can people find out more about you or about anybody else on our team? What is the best place to start? Or you mentioned psychology today if you're not in the Chicagoland area, but if they want to have any interactions with you, what should they do?
So going to the Juniper Center website, let me get that website right now and I'll read it to you. I believe it's just thejunipercenter.com. So yes, thejunipercenter.com. And if you look, there's a psychiatry team page. So if you look at services and you look at medication management psychiatry, all of our medication management providers are listed there. We have both psychiatric nurse practitioners and psychiatrists on our team. There are 7 of us now. We've grown, which has been great. Some of us do in-person in the Chicago area, some of us do telehealth, and some of us do both. So I have patients even down in Southern Illinois that I see that are not in Chicago, that I see that because I'm licensed in the state of Illinois, I can see those patients. We've got lots of really great providers. There is care out there. Sometimes it can be a little bit of a wait. So don't think that you're going to call and get an appointment tomorrow. That's not how that works, unfortunately. Sometimes, and in some areas, there's a longer wait. And so we do have a shortage of psychiatric prescribers in this country, and it depends on the area if there's more or less availability. For pediatrics, it's even longer wait sometimes, which is why a lot of times you might need to go to primary care first or a pediatrician first to get something started, because it can be sometimes up to a 3-month wait. And it depends on if, provider takes your insurance or is fee for service and doesn't take any insurance. That happens too. So yeah.
Folks, if it's an emergency, do not hesitate to go to the emergency room. I have been in emergency rooms doing triage, trying to, from a psychiatric or mental health perspective. Those folks who cover the ER typically have some experience. And boy, if you have any concern and it is a mental health crisis, please go to the ER.
Yep.
Otherwise, find someone in your area who can help. So,
Absolutely.
Dr. Ann Thatcher, go ahead.
I was just going to add one last thing. Some areas have psychiatric ERs as well, or psychiatric urgent cares. So look in your area to see if that's an option as well. If you're afraid to go to the ER, go to the specialized psychiatric urgent care or ER, because those are even more helpful too. But yes, that and calling 988, which is the crisis line. You don't have to have suicidal thoughts to call 988. You can call them if you're having a panic attack. If you're upset about a relationship breakup, call them. It's counselors. They're 24/7 available.
And you just have such a wealth of information. I really appreciate you and appreciate all the work you do for us and your generosity being here with us today. So, folks, we are so happy to have you here with us. Dr. Ann Thatcher, thank you very, very much for taking time out of your busy schedule to join me today. And since you work for the practice, I know how busy your schedule is. Really appreciate it. So folks, please feel free to reach out to us if you have any questions. We'll have all of Dr. Ann's information in the show notes, as well as some other resources for you. So please join us again next time. We look forward to having you. Be well.